You're watching CTOM TV. Knowledge is power.
So precision oncology is very different. Precision oncology is a science of where general prostate cancer treatment is going, but it may not be here yet. And there's a big difference between what is being done in some places and what is being done in all places. And I think a perfect example of that, when people say, well, if this, amazing technology is available, why don't we have it at my local hospital? And I like to use the analogy of, why don't we have clean drinking water for all Canadians? Maybe if we get that solved, then we can go on to more complicated things, such as getting some of these advanced treatments around. However, if you have prostate cancer or any type of cancer, what is really important is knowledge. Knowledge is power in anything you do. And so if you know the technologies that are available, then you could go out and seek them. You don't have to sit back and wait for them to come to your local hospital, which could take 10 years. You can actually say, well, I've heard of this new technology and I would like a part of that. I've looked at the data. It's amazing. It's much better than what my doctor's offered me. So I'm going to go to that hospital and get that. And often you can actually have that technology here just in a local hospital, but you'll have to pay for it privately. And that's not always discussed because a lot of times the doctors don't know what's being available private, what's going on. So a little bit about diagnostics for prostate cancer. Something called the PSMA PET. It's been around for quite a while. And in fact, the technology has been around in Canada, has been really forefronted in Canada for a long time. However, for some reason, it's just, it's not being used on a regular basis. There's been clinical trials where they've used it, but I suspect the cost of the scan is a big problem, why the Canadian government is not completely doing this. But you can get PSMA scans and there's private facilities across Canada where you can get them. So basically, what is a PSMA scan? Well, the PSMA molecule is called the prostate-specific membrane antigen. So the membrane refers to the outside of the cell, and antigen refers to typically a polysaccharide or some sort of molecule that is unique to a cell type. And it helps the immune system determine, this is a cell from this area, or this is a cell from this area, and it should be in this area. So with PSMA PET, what they do is they have this molecule that will bind onto PSMA. So basically 99% of prostate cells have this PSMA molecule on their surface. And if you have a prostate cell that's somewhere else in your body, then that's not a good thing. That has to be a metastatic prostate cancer. So prostate cells can only live in the prostate unless they're cancerous. So the idea of the PSMA PET is it's a molecule. It's much like an antibody. In fact, the early PSMA PETs did use an antibody, but now they use a much more efficient small molecule. And this molecule, when you inject it into the blood, it will seek out every cell in the body that has this PSMA molecule, and it will bind onto it. So what some brilliant scientists did was they thought, well, let's attach a radioactive tracer to this molecule. And then what we'll do is we'll inject this radioactive tracer and this small molecule into the person's blood. We'll wait a couple hours and then we'll give them a CT scan and see, and that should allow us to detect every single prostate cell in the body and detect metastasis. And so they did that, and sure enough, it worked incredibly well. And so PSMA PET, as you can see, is about 92% accurate at detecting metastasis, whereas a CT and bone scan combined, the two together, two independent scans, are 65% at best. So it's really important to understand if you have metastasis in your body, because the treatment is very, very different if you have metastatic disease and if you don't.
Thank you for watching CTOM TV. Subscribe below and stay informed.